Today's topic of discussion is pharynx. My name is Dr. Muhammad Sharjeel Ilyas and I am working as Assistant Professor in Postgraduate Medical Institute, Amiruddin Medical College, Lahore. Objectives of today's topic are to know structure of pharynx, boundaries of pharynx, parts of pharynx, Walder's ring, Killian dehiscence, blood supply and venous drainage, nerve supply, and clinical significance of pharynx. The functions of pharynx: it regulates the passage of air to the lungs and food to the esophagus. It also protects the airway and food passage from viral and bacterial infections with the help of tonsils. The pharynx is a muscular tube that connects the oral and nasal cavity to the larynx and esophagus. It is situated behind the nose, the mouth, and the larynx. The pharynx begins at the base of the skull and ends at the inferior border of cricoid cartilage. Its length is 12 centimeter. Its width varies in different regions, like its uppermost part is wider, that is 3.5 centimeter, and it is non-collapsible, while the lowermost part is narrowest, which leads to the esophagus. Now discussing the boundaries of pharynx. Superiorly, base of the skull, including the posterior part of the body of the sphenoid and the basilar part of the occipital bone, in front of the pharyngeal tubercle in the skull. Posteriorly, the pharynx glides freely on the prevertebral fascia, which separates it from the cervical vertebral bodies. Anteriorly, it communicates with the nasal cavity, the oral cavity, and the larynx. Thus, the interior wall of the pharynx is incomplete. Inferiorly, the pharynx is continuous with the esophagus at the level of the sixth cervical vertebra, C6, corresponding to the lower border of the cricoid cartilage. Discussing the parts of the pharynx, very important topic. The first and uppermost part is nasopharynx, shown in this color. It is present between base of the skull and soft palate. It is continuous with nasal cavity anteriorly and performs a respiratory function. It is lined by respiratory epithelium, the pseudostratified columnar epithelium with goblet cells. Posterior superior, there is another part which is oropharynx. It is the middle part of the pharynx located between the soft palate and the superior border of epiglottis. It contains posterior 1/3 of the tongue, lingual tonsils, and palatine tonsils. It is voluntary. It controls voluntary and involuntary phases of swallowing. Now talking about the tonsils. Tonsils are collections of lymphatic tissue located within the pharynx. They collectively form a ringed arrangement known as Walder's ring. Now, the nasopharynx and oropharynx, both of them contains 4 tonsils. Pharyngeal tonsil is present in nasopharynx posterior superiorly. Tubal tonsils is also present along with pharyngeal tonsils near the opening of auditory tube. It is a pair of tubal tonsils, while pharyngeal tonsils are only one. Now, palatine tonsils, they are present in the oropharynx area and lingual tonsils on the posterior one third of the tongue, again present in the oropharynx area. So two types of tonsils are present in nasopharyngeal area, while two types of tonsils are present in oropharyngeal area. The tonsils are classified as mucosa associated lymphoid tissue, MALT. They contain T cells, B cells, and macrophages. So, the first line of defense against pathogens entering through the nasopharynx or oropharynx are tonsils. So, this is pharyngeal tonsil present in the nasopharynx area. This is the posterior superior border where it is present. This pharyngeal tonsil is also called adenoid, a very famous term used in clinical medicine. So, if the adenoids are large, enlarged due to some bacterial or viral infection, they may obstruct the posterior nasal aperture and may interfere with nasal respiration and speech, leading to mouth breathing. So, mouth breathing again have many side effects. These tonsils usually regress by puberty. Their age is 3 to 8 years, and after they regress. Near to these adenoids, there is opening of eustachian tube, and there are present a pair of tubal tonsils. These tonsils, hypertrophy of these tubal tonsils may occlude the auditory or pharyngotympanic tube, leading to middle ear problem, commonly called glue ear, where the ear in the middle ear cavity is replaced by flute, and it has different various symptoms like very severe earache and other fever, headache, and other symptoms. This is anatomy or structure of ear from left to right, showing external ear, then middle ear, and from middle ear a tube is coming out which is called eustachian tube and connecting the area where adenoids are present. Here tubal tonsils lie. So, two types of tonsils, adenoids and tubal tonsils we have discussed, which are present in nasopharyngeal area. Now in oropharynx, a very famous, which commonly we call tonsil, palatine tonsils are present. They rest within a tonsillar cleft, bordered anteriorly by the palatoglossal arch and posteriorly by the palatopharyngeal arch. They are lined by stratified non-keratinized squamous epithelium. So, this is in the green color, again showing palatine tonsils. Now, the supply of these tonsils, the arterial supply majorly through tonsillar branch of facial artery. There are other branches of the external carotid arteries, facial artery, lingual artery, and maxillary artery that supply palatine tonsils. The venous drainage is through external palatine vein into the facial vein, and they drain into jugulodigastric and upper deep cervical lymph nodes. Nerve supply is maxillary nerve and glossopharyngeal nerve, obviously their branches. This is the condition which is called tonsillitis. In the middle there is uvula, and on sides a pair of palatine tonsils, they are swollen. So, what is tonsillitis? When the tonsils become infected, diagnosis, one of the easiest way you can tell tonsillitis apart from a sore throat is by looking at the tonsils themselves, saying patient to open his or her mouth, and with the help of a torch you can just assess the inflammation of tonsils. symptoms: fever, headache, chills, bad breath, and bacterial and viral infection may be the causes of these tonsils. Now, there are different types of tonsillitis. You don't need to remember these things. Just uh, listen these terms: acute tonsillitis, chronic tonsillitis, and recurrent tonsillitis. And treatment: to treat tonsillitis at home, you can use some home remedies, or best is to go to a doctor. Now, on the posterior one third of the tongue, there is presence of lingual tonsils, refers to numerous lymphoid nodules located within submucosa of the posterior one third of the tongue. So, collecting all these types of tonsils like pharyngeal, tubal, palatine, and lingual tonsils, we can see they form a ring, a circular ring. So this ring is called Walder's ring, and this is first line of defense against infections or any other agent which is coming through nose or mouth. The third part is laryngopharynx. The most distal part of the pharynx, located between the superior border of epiglottis and inferior border of cricoid cartilage C6 level. Muscles of the pharynx, very important topic. Pharynx consists of an outer circular layer made up of the three constrictor muscles, that is superior constrictor, middle constrictor, and inferior constrictor, while an inner longitudinal layer made up of three longitudinal muscles: palatopharyngeus, salpingopharyngeus, and stylopharyngeus. First of all, superior constrictor. The origin of superior constrictor is through pterygoid humilus, pterygomandibular raphe, posterior end of mylohyoid line of mandible, insertion and pharyngeal tubercle on basilar part of occipital bone. This muscle is innervated by through vagus nerve, pharyngeal plexus. Function: it constricts the upper portion of the pharynx during swallowing. Stacking up the superior constrictor, the next one is inferior constrictor. Origin is from stylohyoid ligament, greater and lesser horns of the hyoid bone. Insertion in medial pharyngeal raphe, blunts with superior and inferior pharyngeal constrictors. Innervation again the same, vagus nerve through pharyngeal plexus. It constricts middle portion of the pharynx. The third and very important, inferior constrictors. We divide it into two parts: thyropharyngeal part, the upper one, and cricopharyngeal part, the lower one. Thyropharyngeal part originates from oblique line of thyroid cartilage, while the cricopharyngeal part originates from cricoid cartilage. Insertion again, thyropharyngeal part inserted into median pharyngeal raphe, while cricopharyngeal part blends inferiorly with circular esophageal fibers. Innervation, both parts are supplied through vagus nerve, pharyngeal plexus, and there is another supply of cricopharyngeal part. It also receives supply from recurrent laryngeal nerve, again a branch of vagus nerve. It constricts lower portion of the pharynx. So, thyropharyngeus and cricopharyngeus have Achillean dehiscence, an area where thyropharyngeus meets with cricopharyngeus. It's a very thin area. The area between two is weak in mucosa and is called Achillean dehiscence. During swallowing, thyropharyngeus constricts while cricopharyngeus relaxes. If somehow both of them constricts, the food just escapes through the weakest portion between thyropharyngeal and cricopharyngeal area, the area which we call Achillean dehiscence, and it forms a diverticulum which is called pharyngeal diverticulum. So this is another problem in clinical medicine. Now the longitudinal group of muscles. First of all, palatopharyngeus. It originates from posterior border of hard palate and palatine aponeurosis, and it is inserted into thyroid cartilage. It is also supplied by vagus nerve through pharyngeal plexus, and the function is it elevates pharynx superiorly, anteriorly, and medially. So shortening of pharynx, shortening of this muscle helps to swallow. The next one is originated from cartilaginous part of auditory eustachian tube. This is sulfingopharyngeus. It blends with palatopharyngeus muscle, and it is also supplied by the vagus nerve through pharyngeal plexus. It elevates pharynx, opens auditory tube during swallowing. So it also helps to maintain the pressure in the middle ear cavity and in pharynx. The third one is stylopharyngeus, stylopharyngeal muscle. It originates from medial base of styloid process of temporal bone and inserted into it actually blends with pharyngeal constrictors. Innervation. This is the only exception in all pharyngeal muscles. A very important thing to remember that all pharyngeal muscles, all muscles of pharynx are supplied by vagus nerve except palatopharyngeus, which is supplied by glossopharyngeal nerve. It elevates pharynx and larynx. So we often call pharyngeal plexus when we talk about nerve supply of different muscles. So what is pharyngeal plexus? Actually, it is formed by fibers from the glossopharyngeal nerve and fibers from the vagus nerve and the fibers from the 11th or accessory nerve, spinal nerve. The fourth one are sympathetic fibers from the superior cervical ganglion. So the pharyngeal branches of all these four nerves, they form a pharyngeal plexus. It is formed on the middle stricture. So it gives sensory supply as well as motor supply. We have already discussed about motor supply. Now the sensory innervation of mucosa. So the color features easily show that in purple color, the nasopharyngeal area, it is supplied by some of the nasopharyngeal area is supplied by second maxillary nerve, which is a branch of trigeminal nerve, second branch of trigeminal nerve, and the area combining oropharynx and nasopharynx is supplied by glossopharyngeal nerve, ninth cranial nerve, while the area of laryngopharynx up to the esophagus, it is supplied by vagus nerve. The arterial supply of pharynx, the very famous external carotid artery and its branches, ascending pharyngeal artery, facial artery, lingual artery, and maxillary artery. The venous drainage is through pharyngeal venous plexus and into the internal jugular vein.